United Health Services serves as one of the largest healthcare providers in the New York State, greater Binghamton area, offering a range of anything from primary care to specialty care services. We have 4 hospital-based labs, and then we have several outreach laboratories that act as draw stations, in addition to multiple doctors' offices. In any given year, we produce the work of 3 to 4 million individual tests. One of the most exciting things is that for the first time in probably 3 decades, we've opted to expand our clinical footprint. So we have a 6-story state-of-the-art building that's in the middle of our construction that's going to expand the services that we're able to provide to our population and also really make UHS grow. Within the last 3 years, we've managed to make sure that all of the laboratories in our system are on QuidelOrtho products, and 2 of the 4 laboratories that are the largest specifically have the XT system with the 7600s. We want to make sure that we have the same consistency and reliability. Our patients don't just choose one laboratory, they choose United Health Services, and they expect the same level of care wherever they go, and it's our job and our duty to provide it. Dry slide technology is wonderful, and it's not just all about the water, which we need to conserve as it is. There's no more reliance on having to have someone dig a drain. There's no more reliance on having a bulky water system that could get contaminated. And the footprint and the integration of being able to do every test we needed in one box makes life so much easier. And there's a baseline of stability, a robustness to the tests that are offered, and a quality that I can see consistently, whether it's quality control, the patient results, a proficiency sample, a replicate, and especially when I'm calibrating almost 100 assays. So currently in my particular laboratory, we have 3 VITROS 7600s, and that is attached to the VITROS automation VAS system, which is entry-exit module. It has a decapper, a recapper, and we even have really great light poles that kind of tell us what's going on with any part of the track or the instruments at any given time.
We all love working with the VITROS. It makes our lives easier, especially with the automation. Being able to load things on the fly is huge. We can load the ERF if we ever need to. It's just easier to use because I've worked with other analyzers where even just to load the reagent itself, the whole analyzer has to be in standby. You have to take the top off, you have to load a cartridge, and then you have to wait for it to initialize again and come back to temp, and so you can run your patients. With the VITROS and the dry slide, we really like working with the VITROS.
We absolutely chose to be early adopters of the XT system. One of the biggest reasons was not only storage space, but process improvement and workflow optimization. The less things you have to store and the less things you have to load, the more time you get to focus on your actual patients.
It's faster to produce the analyte because 2 slides are now merged to 1. So as the analyzer is analyzing them, it takes less time.
One of the other benefits is I can count on it. There's a robustness to the test I'm able to offer. There's not a lot of interferences, and I can count on quality and stable results, whether it's my patients, whether it's my quality control, whether it's a replicate of something. And in addition, now when I calibrate, I feel like I have much more confidence in the calibrations that I do because there's a factor of stability involved. Overall, it's much more efficient, and it really allows us to expand the number of tests that we're able to do and expand the number of patients we're able to service so far.
It's very rare that we have to call service, and if we do call service, they can walk us through, and we 9 times out of 10 can fix it on our own. The VITROS have made maintenance easier. Daily maintenance, you're really just wiping down a few things, making sure the probes are clean, changing your ERF daily, and every 3 days your IWF. So within 10-15 minutes, you're done with daily maintenance and on with your QC.
I think one of the number one things that we find in healthcare is that it's not a static environment. It's very dynamic. What we love most about our partnership with QuidelOrtho and the instrumentation and the VAS that we do have is the flexibility to add tests, the flexibility to focus on the things that we need, allows us to mimic that flexibility that's needed to handle the day-to-day changes that you see in any healthcare environment. And it's almost like the system can predict our needs. And every time we turn around and we have another need, the folks at QuidelOrtho come in and go, we have a solution just for that. With 100% certainty, I can say to any hospitals that are out there looking for something that can grow and adapt with them, something that can make their lives a lot easier and something that they can rely on for patient care, that a partnership with QuidelOrtho, it's the #1 right choice to make.